Thank you ever so much. So thank you all for joining us this morning. It's really good of you to take the time out, and we hope you're going to be as excited about the Smile Imaging software as we are. First of all, for those of you who don't know me, my name's Tracy, and I have been working in dentistry now for over 3 decades, and in the field of Smile Imaging consultant for the last 10. But that's enough about me. Let me tell you about the software. So basically, it's a computer software that enables you to design every aspect of your patient's smile in less than a couple of minutes, and while reducing patients' expectations at the same time. So it's a very, very powerful marketing tool as well. But let me get on to the actual lecture itself. Okay, so it's cosmetic imaging for aesthetic dentistry. And during today's webinar, we're going to be looking at photography, everything that's involved with photography, so the type of camera, printer, actual photo required, the procedures of Smile Imaging, a case presentation kindly sent in from Professor Paul Tipton, and also the evidence and success to help you with imaging in the future. So without further ado, let's look at our first section, which is on photography. As I said, we're going to be looking at cameras, type of photo required for imaging, as well as the quality, so often common mistakes that are made with imaging, a celebrity smile makeover, as well as importing and exporting of photos. Okay. So we're often asked which is the best type of camera to use for imaging. And although many of you probably already own an SLR camera, that's not actually required for imaging, okay? All we need for the quality of photo we require is a good point and press camera like this that you can see. Always take your photos with the flash on. And also we're often asked, will iPhone, smartphone be suitable for imaging? And although they take great shots, when we're out on holiday, nice headshot photo of yourself or your friends, when you actually zoom in from an imaging point of view, when you're looking at the teeth or a single tooth, that is often not in focus. So if you don't have an SLR, just a point and press, very reasonable camera is worth investing, and it will produce great quality photos for you every time. Okay, so let's look at what type of photo is required for imaging. So this is a photo of Jan here. This is a full headshot photo, as you can see. So just above the top of the head to below the chin there, eyes wide open, big smiley face, and a clear background behind. And this is all you need for imaging. This is the perfect shot, okay? Now, if we look at this photo here, this is one that we've had in our image service department, okay? So it's a full headshot photo from the dentist, as you can see, but our eyes are automatically straight away drawn to the dentist in the reflection of the glasses there, the pink gloves and the TV and everything else that's going on, as well as seeing the nurse in the background, and we're not focusing on the teeth. And so when we present the imaged case to the patient, exactly the same really. Their eyes are taken away from their own teeth, and they're looking at, what's going on in the glasses, the same as we are, rather than what's actually changed about his own teeth. So if you can, a nice clear background, get them to stand against the wall or something, and a nice headshot photo. So the quality of photos and common mistakes that can be made when taking the photographs, we often find dentists take it on an angle, okay? So as you can see with this, it's not looking attractive from the start, really. So even if we image this lady's teeth and make them look beautiful, it's still not going to be an attractive shot for her. So we can only really see one eye, and the way it's taken makes her nose look quite big. So think about the angle. Now, they say the camera never lies, but let's hope in this case that it does. So really think, what you're looking at is what you're actually taking when you're taking your photographs. Also, we need, as we mentioned, the photo to be in focus. So we need to see the teeth that we want to image. And here we have two close-up shots that dentists often like, okay? So we always, dentists love retracted shots and close-up photos like this of teeth. But patients actually don't buy into the smile in this way when we present an image case with a retracted shot. If you think about it yourself, if you was going to buy a new jacket, you would want to see how your head looks as well as, you know, your lower part and your legs. You don't just want to see the jacket area, okay? So it's exactly the same. When the patient's buying into the new smile, they want to see how the teeth are fitting into the whole head, okay? So think about that and get the full headshot photo for imaging. So you might think this is the perfect shot then for imaging. Full headshot of this gentleman in focus, eyes open, you know, and nice smiling face. But obviously we can't see his teeth. So when we get photos like this into the image service department and we're asked to show how the new smile would look, it makes it a very difficult job for us. So don't forget that we actually need to see the teeth when either you are imaging the cases or if we are. So this is an actual full face photo received again at our image service department. When we sent the image guidelines back to the dentist asking for us to be able to see the teeth to image, this is the great shot that we got, okay? So again, it's not a great angle. It's making the gentleman's nose look a bit big, and because he's pulling his lips down. I mean, none of us look that attractive like that, yes? So we want to think about the golden proportions, how the lips are naturally falling around the teeth, not, you know, having them pulled around. So before we image the case. So with that in mind, we're going back to Jan, the original good photo that we saw, okay? And as you can see, this is her before photo and her image case on the right-hand side there. And you can see from that that we've actually imaged two teeth and given her a whiter smile. Now, this really allows the patient to see all of the modifications within their own face with no obligation before they commit to a treatment plan. So in less than a couple of minutes, we can show her how, for example, 4 teeth would look, 6 teeth would look, or a full smile makeover. And being able to present the treatment plans like this in a way that the patient understands, they can then decide which one they want to go with before you spend time in practice taking the diagnostic wax-ups, etc., and spending all of that time you know, on the case before the patient is fully committed. So this really allows the patient to decide and try on the smile before they buy, okay? So here we have a lot of celebrity smiles that I'm sure you're all aware of, recognize all of these people here. And often we get new patients or existing patients come in and tell us that something they don't like about their smile and they want to look like George Clooney or Victoria Beckham. And, you know, that's really good because we can understand what kind of smile they want. So we can then produce the case for them. So this is a screenshot of our aesthetic controls within the software. So I want to take you through what we're actually able to do. So we have a list of all of the procedures within the software. So you can see we've got whitened teeth, crowns and veneers, etc. Now, for those of you that are observant, you'll notice that there's not one that says orthodontics or facial aesthetics, but we can actually still image those cases. So all of the procedures do more than what they just say on the tin, if you like. So crowns and veneers would also do orthodontics. So there's always other tools that, and so would bridge and implant also do orthodontics. So it's just knowing what treatment you want to show. So if it was a full orthodontic case, we would use crowns and veneers. If it was just one tooth that maybe needed to be rotated, we could either show bridge and implant or gums and perio for that, okay? So it's, and obviously we would teach you what to do with that. There's also lots of tools, so we can crop photos, brighten photos in our individual section on the lower part there. And you can see the filing cabinet at the bottom. And I just wanted to draw your attention to that, because on the right-hand side, you can see 4 smiles. There's actually 30 smiles that come within the software. And that really enables you to show lots of different shapes of teeth, okay? So, you know, whether they're square, more dominant, or more rounded and more beautiful smiles. So we've got lots of smiles, 30 smiles within the library, but you can also add to that with your own retracted shots from the filing cabinet there. Okay, and then obviously we need to think about the golden proportions, as I've mentioned, when we're designing our cosmetic consultation for the patient. So we've got some great tools here within the software. So we've got the adjust transparency. So when we put new teeth in, we can click on the adjust transparency and we can see their existing teeth underneath. So then we can use the stretch box and we can size the teeth and make sure that they are anatomically correct, as obviously a 2-dimensional photo can be. We then have the curved bite line that you can see. So we can do the occlusal plane with that. If they've got the reverse smile or, you know, more smiley face, we can move the slider bar whichever way to make it match in with their existing smile. And then we have the color, contrast and teeth brightness. So we can get it exactly right if we're matching teeth into their existing smile. Or obviously, if they want a whiter smile, we can show that for them. So you may wonder why I've got a picture of fruitcake and in this morning's lecture. It's not because I'm trying to make you feel hungry because it's lunchtime. We always need to be aware of that fruitcake patient. So if our patients come in and tell us that they want a whiter smile like Simon Cowell, we know that's not actually going to be possible through whitening. Yeah. So by imaging them with whitening, we can actually reduce patients' expectations. And then if they don't like the whitening photo, we can image them with veneers and explain to them what's involved with that. But it's much better that we give them the prototype smile for them to decide if that's correct. And we've got a patient that is aware, rather than doing the whitening and having an unhappy patient at the end of the whitening treatment because the teeth didn't come out as white as Simon's, for example. Okay. So we're now going to look at a celebrity smile makeover. I'm sure you'll recognize Cheryl here. So this is going to enable her to see, obviously, how her smile was going to look. Obviously, we know she went ahead with the treatment plan, but this is the before photo. And we're going to look at this in real time. Okay, so this is how fast it is for you to show your patients makeover. So on the top left-hand side, you can see crowns and veneers, which we've clicked on. We've zoomed the photo in, and now I'm left-clicking and releasing around the patient's smile. If you just was going to do, say, the front centrals, you just go around the front 2 teeth. But obviously, in this case, it's a makeover, so around the whole lip line. We'll zoom it in again so we can see it a little bit more clearly. And then we can click on the various teeth within the library there. So you can get the shape of tooth that the patient would like. And we can do this with the patient, so it really helps in the co-diagnosis part of the treatment plan. I've then adjusted the curved bite line to make it more smiley, matching her own lip line. And we clicked on the stretch box. So we can see her teeth underneath there, and we can size it to put them in so that they are the correct size for her face. Okay, once we've got them sized out correctly there, we can then look at adjusting the color and the brightness as well. So again, when you're doing this with the patient, we can talk to them and decide what kind of whiter smile they are actually wanting to have. Once you've got their image case for them to visualize, you can then export that photo out. So this is our export screenshot of the screen there. And you can notice on the photo, hopefully you can all see it depending on what size screens you're looking at, but underneath the photo it says Smile Imaging for Tipton Training, but obviously you would have your practice details, telephone number, etc. So it's great for when you send it out virtually at the moment. I know some of you are actually getting back to practice this week, which is great, but for a lot of our practices during the lockdown period, they've been doing online Zoom consultations with their patients, taking a photo of how they look and obviously imaging it and getting everything set up, ready and decided for when they return to work so the patient can go ahead with that treatment plan. Okay, so we are now going to look at the next section within the webinar today, and that's the simulation procedures. Okay, so all of these procedures are listed down here. As I say, we can do all of these in just a couple of minutes before you pick up the handpiece. So it's a real powerful tool when presenting all of these cases to your patients. So we're going to look at each of these individually now. So the whitening of teeth is obviously very popular treatment, and we're going to click on whiten teeth there. You can see the software automatically analyze the area that we want to work with, okay? So now we can adjust the color, slider bar, okay, that's the whiteness, and then the brightness. So you can see the difference there. Once you think you've got it about right, you can click on next from the bottom of this blue box there. And once we click on next, you've got the side by side. So you can see the before picture and you can see the after. So you can look at her existing teeth and actually work out exactly where you think whitening's obviously going to go. We never know exactly, but we can get a good idea and print that out. Okay, and it's very important as well when we print these photos out, it says there that it's a simulation and their results may vary. So you're covered medical legally. Okay, and when we think that 40% of the population want a whiter smile, obviously, you know, that's almost half of your patients. So it's, you know, a lot of people. So by offering this as a service, it's a great way that patients can see potentially how their smile could look. And then we can, as I say, virtually at the moment, send these photos out to the patient, or when they're back in practice, we can print them off and give them to take away. Okay, so here's a case that Professor Tipton has kindly given us to look at this morning, guys. It's a crown and veneer case, but although, as I mentioned, crowns and veneers can do other treatments, so all on fours, orthodontics and dentures could also be done with crowns and veneers. As you can see, this is a gummy smile. This lady attended Professor Tipton's practice concerned with, and Paul did a full gingivectomy to give a full makeover to give her a new smile, and he told us that he would be able to reduce the gummy smile completely. So when we did the image, we could show her that. Now, obviously, if you don't offer imaging, the way that we can show patients, we can obviously have before and after books like this, or maybe some scary photos. You obviously need your diagnostic models on a case like this to find out what's actually achievable. And you might have some sort of computer-aided, generated information to show the patient as well. And for those of you who've got before and afters of a similar case, that's really powerful and the next best thing to being able to show them in their own smile. If you've got somebody else's case, then that's the next best thing. But for this lady, obviously Paul used the imaging to show her a clear idea of communication, how we could change her smile. So with Paul communicating that to us, we can then also send the photos to the laboratory, again, to stop breakdown in communication. And then obviously here's the beautiful case that Professor Tipton's created for the lady, and you can see obviously, wow, what a difference that is and how pleased she was with that. Okay, so our next tool within our procedures is the fill cavity tool. As you can see here in our top photo, we've changed the amalgam restorations to white, more aesthetic, stronger replacements there. So if you've got intraoral cameras, this is a great way to show patients how their smile can be changed with the imaging there. And you'll notice obviously that we've also got facial aesthetics. So our fill cavity tool will show all of the Botox and filler treatments as well. So again, at the moment, it's been a really powerful way for our practices that use the software, have been doing virtual consultations, skin consultations, and being able to talk to patients what they don't like about their skin, and then show them how they could look with some Botox. And here you've got an eyebrow lift as well for this gentleman. For the eyebrow lift, we actually use the bridge and implant tool because that's a copy and flip tool, and that enables us to, anything we don't like on one side, if there's something okay on the other side, we can just flip that across and show them, and that's how we do the eyebrow lift as well. But we'll be looking at that a little bit later as well. So I'm going to show you the fill cavity actually in action in our next video, and our next procedure is gums, perio and cosmetic bonding. And as I say, we'll also look at the fill cavity in this section as well. This is my favorite tool within the software, actually, this one. Okay, so click on the gums and perio, and obviously this is how you can change the gummy smile for, say, like the case that we just looked at with Professor Paul. Okay, so we're clicking around where the tooth and gum meet. Okay, we do that by left clicking and releasing. We can draw straight lines. And then once you've marked out the area, we can go up to next on the top left-hand side. You'll notice there's always flashing instructions, so it's always telling you what to do as well. And then you can stretch the box up as it says and show them the difference between the gummy smile and a less gummy smile. Same way we could go around the top lip and then bring the lip down if it was fillers, and we was dropping the lip in that way as well. So now we're going to look at doing a little bit of cosmetic bonding on that chipped central incisor. And the way that we've done that is we've just drawn kind of incisor ledge shape there. Okay, so we've got this piece of bonding now that we can move around and place onto the tooth. Once we've placed it into the area and we release the click on the mouse, the square box appears. Okay, and you can see now we can move that around and get it just right. And this is also the way that we can move teeth in the orthodontic field. So if you just want to move a tooth a little bit, this is the way we do it. Okay. And then finally, we're going to use the fill cavity tool. So this was the one that we used for the facial aesthetics, smoothing of the lines. This obviously we're going to do the teeth. So clicking on a piece of tooth colour that you like, it picks up that colour, and you can then adjust how dark it is, and you can smooth out the colour and smooth out the lines. The only reason we've got the lines on this is because we've blown it up, and you'll notice that although I said at the start always use a full face, some of the cases I've got blown up like this because obviously from talking with dentists you'd like to see it close up, so that enables us to do that. Okay, so explaining restorative treatments in the past is always quite difficult when we're showing a chipped tooth, if we've got computer generated things like this, to show patients, for them to fully understand how it's going to look in their own smile. But as you've seen, very quickly, in just a couple of minutes, we can image a fractured tooth or, you know, show a new crown. And it really builds value to your treatments as well. So here now we have our next procedure, which is the closed diastema tool. So this is a common case, isn't it, that comes in, the closed diastema. And we really need to think again about the golden proportions before we image this case. So it's quite a large diastema he's got there. And if we just say he would like to close the diastema with just bonding or 2 crowns, they're going to look quite wide. But the beauty with this is that we can image that for him and show him that kind of smile. And then again, we can image all of the teeth, closing the diastema. So saying, by showing orthodontics, for example. So you can see the difference and again, decide which is going to be the best option for him. Actually, this gentleman was getting married in a couple of months and he didn't want to have orthodontics. So he actually wanted a whiter smile with crowns and veneers. And you can see we've also imaged that for him. So it's clear communication, and obviously then the patient can go ahead with that. And also, as we mentioned, it breaks down, stops communication breakdown with the patient and the laboratory. Okay, so we're going to look at the closed diastema tool in action again now for this gentleman. Okay, so I've clicked on closed diastema and I'm zooming in on the slider bar down at the bottom there. We're going to do his lower teeth first, and you can see there I'm doing straight lines and I'm clicking around the 4 teeth on one side. Click onto next and do the same thing. So click and release. It's like dot to dot with the mouse, okay? So it's so easy. Up to next. The flashing instructions are telling you what to do, and you can just pull the teeth together. You don't think you can fully close the diastema. Again, you know, always under promise with your image case and over deliver in the mouth. You know, you don't have to fully close it. If you feel that orthodontically say you might not actually be able to close it completely, then, you know, obviously don't image it that way. So you've got full control to give the patient a realistic image and then excite them to the treatment plans. So we've gone around the teeth on one side, and we're doing exactly the same thing again there on the other side. Up to next, and the 2 boxes have appeared again, or as I say, you can pull them completely together or just partially if you wasn't confident that you could fully close it there. Okay, and then you've got a beautiful case to present to your patient. Right, so our final procedure within the software is bridge and implant. Okay, so as I mentioned before, all of these tools can do various things. So from our first photo here, you can see we've replaced the gold crown with a white crown, and the way that we've done that is we've gone around the 7 on the good 7, flipped it over. As I said, bridge and implant is a flip tool, copy and flip tool, and then replace the gold crown, and then you can size it exactly the same. Square boxes appear and you can size it into place. Same thing done with the eyebrow lift that we looked at earlier. Go around the good eyebrow, flip it over, and the same with the older gentleman there, replacing his teeth there. So we're going to look at it in action now for this young guy here, who unfortunately has obviously lost his central and lateral incisor, and be able to show him in real time how he could look if we replace that for him. So left click on bridge and implant, and then zoom in on the slider bar again. And then we're going to just draw straight lines around the 2 teeth that we want to copy. So obviously the central and lateral, and it will copy and flip that over. So we can give him a very fast virtual idea of how he could be looking. And obviously this is so much more powerful than your diagnostic wax up. And all of this can be done before taking that kind of time to do all of those treatments. So the patient can see what they want to have done and then go ahead with it. Okay, so we've sized the teeth into place there. And obviously it's given us a perfect colour match because we've used his own teeth. But in the same way, we could use crowns and veneers, put new teeth in and give him a whiter smile. So maybe that's the way he wants to go. And if that's the case, we can look at the 2 teeth, okay? And if he said, yes, I'd like to go with, 4 veneers maybe and a whiter smile, then we can image that for him and show him that as well. So it's, creates the emotion, and allows them to try on the smile before they buy. Okay, so our next section within this morning's webinar is the smile imaging, the equipment that's required for imaging. We're going to look at imaging reviews and the imaging technique in more detail, okay? So basically, if you decided to offer this as a service for your patients at your practice, you could either use our image service, and there's a screenshot of that from our website, or you can obviously purchase the software and offer this service to all of your patients that come through the door. And all you need for that is a computer, which most practices already have. It runs on a Windows computer, but if you have Mac, the same as myself, you just run it on Parallels and it works perfectly, okay? As we mentioned, you want to take good quality photos, okay? So if you have an SLR, that's absolutely fine, but if not, just a point and press camera works perfectly well for the kind of quality photos we require. If you decide, once you return to work, if you want to print them out, a 6x4 printer works perfectly because it's so cost effective. It works out about 24 pence a print to print the photos out, and you can print them out like this for the patient to take away. So it's a really great marketing tool for your practice. But when the patient is either with you virtually online or when you're talking to the patient in the practice, if you've got the image on your computer screen, or if you've got a big TV screen like this, then that's really powerful for them to see and buy the emotion when they see the pictures blown up like that. And as we mentioned, a mouse is actually the best thing for imaging. Sometimes dentists ask whether they can just use a finger pad on a laptop, but it does make it more difficult. So if you can dig out an old-fashioned mouse from the back of a drawer, that will work perfect for you. Okay, so imaging review. As we've spoken about briefly, we need to think about the golden proportions when we're putting in our new two-dimensional photograph. Okay, so how the lips are framing the teeth, the size and the width of the teeth, and the length of the teeth. So we need to look very carefully at the photo that we're putting in. So if we look at this case that I've imaged, you can see it doesn't look very good because although I've used the correct sort of shaped teeth that work well, and I've matched the colour in nicely for him, okay, it doesn't look good because I've made them too low. So he's, you know, I've given him a gummy smile and he wouldn't have a gummy smile. So really, you need to always look at the first photo and look at the second photo and make sure everything's matching up, okay? So let's look at that technique a little bit more closely in action together. So we're going to click on crowns and veneers, and obviously we've looked at it from a full smile makeover earlier, but we'll look at it as a close-up. So I've drawn wiggly lines there, and that is by holding the mouse down and just moving it around. So as I mentioned before, that's really difficult to go around the lip line. So the way that we do it is we go dot to dot. So click, release, and if you draw a square box, click, release, you can go around and do perfect imaging every time. Okay, so that's what I'm doing. I'm just clicking and releasing and marking out the area. So I'm just going around, obviously, the 3 teeth this time, rather than the whole smile. Once we go to next, by default, 301 always goes into the library, okay, which we've seen before. So I've zoomed it in. We're going to click on uppers only this time. We've got the angle bar there, so we can make sure we've got the angle of the teeth just right, okay, and then we can click on the stretch box. If we stretch the teeth out and just put 3 teeth into the space, we can then, within the library, as I mentioned, there's 30 smiles, we can then click on the various teeth within the library and decide what shape of teeth we want, okay, so whether we want them more dominant or more rounded. Once we've got the shape of the teeth that we feel will work with that patient, and again, when we do this in practice with the patient, you know, if you do this in practice with the patient, they can decide with you, and it really helps with them understanding the treatment plans and being involved right from the start, okay, before you've picked up the handpiece. And then we've got the colour slider bar there, you can see, and the teeth brightness, so we can adjust it and get it to a realistic level for the patient. Obviously, with this case, we're working with his his own teeth, so we need to match them in to his own shade colour. But again, you could add to that and show them whitening after and build the treatment plan. So it's very easy for them to see, you know, this is with the 3 teeth and this is with white smile as well. Okay, so once you've got your photos imaged perfectly, obviously we need to look at the case presentation, and that's the next section of the webinar this morning that we're going to be looking at. Okay, so we're going to be looking at your practice environment, the chairside manner, opening statements, before and after photos versus image photos, and financials and disclaimers during this section, okay? So you may wonder why I've got a picture like this of a slightly old-fashioned practice, but it's really because we wanted you to be able to visualise. This is how we have photos like this of, well, not like this hopefully, but of our practice on our websites, and that's how patients decide whether they want to come in and see you. So if it's a practice like this that looks slightly out of date and loved, they're probably not going to be queuing up on the telephone to book in and see you. So if you think about when, you know, you're purchasing a holiday, and I know that's a very sore subject at the moment for everybody, but if you saw this hotel, this is a hotel in Paphos that's got vacancies all year round, okay? And you can probably see why. If we look at this photo that we'd all love to be sitting at right now, this is the 5-star Elysium down on Paphos, and you can see where you need to pre-book here in comparison to the other hotel. And so how we look at how the patient looks at your website is how it emotes whether they want to come in and see you. That's, you know, that's their first point of call often nowadays, and that's how they decide, unless they've been recommended, whether they're going to call in. So if you can, obviously have a beautiful photo of your practice reception, the surgery. If you've got a treatment coordinating room, you know, that, show that off as well. Show off all of your rooms and make sure all of the pictures of the team and the staff, as well as yourself, you know, everybody looks friendly and welcoming as well, okay? Now, over the years, we've been into many practices, as you can imagine, and some practices are maybe the signs hanging down outside, you know, it's got the dusty handrail as you go up, and it's not that welcoming really. And it surprised us that, say, for example, the dentist has then told me that they've invested in, say, a blood spinning machine. And that's so that the patients don't get dry sockets, and they put this on the website, you know, that they come into your practice and they're not going to get a dry socket. But what you have to think is, if patients saw something like this and told they weren't going to get a dry socket, unless they actually have had a dry socket, they probably don't even know what that is. So it's well worthwhile to have something showing the photos that they will want to invest in, they will want to come in, rather than something that they probably don't understand and it's not going to generate them to come in. So really think about what you're putting on the website, what's going to motivate the patient, not us, not what excites us. A bit like the retracted shots. We like to see the retracted shots, but the patient likes to see the full head shot. Okay, so now when we're thinking about the chairside manner, okay, so whether you're a welcoming or slightly stern dentist like this guy here, I'm sure none of you are, but who is the best person within the practice? Who builds the best patient relationships? And that is probably going to be the best person, whether it's your treatment coordinator, your nurse, your practice manager, or yourself. Whoever's building the best patient relationship, that will be the best person who will get greater case acceptance to the treatment plans when they see these image cases. Okay, so your opening statement. Well, we want the patient to discover the symptoms with us, okay? So again, we don't want to be scary when we're explaining to them, but we want to take the photos and the x-rays. And then it's really useful, if you give them a handheld mirror, they can actually be part of the co-diagnosis, when you're talking to them and explaining, they can look into the mirror and see how they are going to look, okay? And they can understand which tooth they're talking about. Often we like to use our dental jargon and say to them, you know, their lateral incisor, and they don't know what that is. But when you can point it out to them with the probe and they're looking in the mirror, they're, you know, on the same page as you. And then you can image them so that they can then be taken on the journey, okay? So co-diagnosis, as we said, they gain the acceptance, and this is all before you embark on your surgery time and expense of the models, and then obviously doing your written treatment plans and getting those signed as well. Okay, so we're now going to look at some before and after photos versus image photos. So when I worked as a treatment coordinator myself, I used to do imaging, obviously, and I would constantly be doing cases, you know, where patients would come in like this with a diastema, image the case for them, send them, you know, off, they'd accept the treatment plan, go back to work with the photograph of how they could look. And when they took that photo back to work and showed their colleagues, they would then say, oh, I don't like, you know, this crooked tooth, for example. And they would then phone us up, ask if they could come in for a free consultation to have an image case as well. And then once they came in and obviously saw the photo, we got, you know, another case acceptance, and it really helped generate more new patient inquiries, and it's a great way of marketing your practice, so cost effectively as well. Okay, so with this lady, obviously we could show her the image case that we looked at earlier today. Okay, so you've seen these photos of the two centrals, or the complete sort of smile makeover, and obviously his image case. But nothing's going to excite the lady more than seeing her own smile. And as we've said already, this is taking them on an emotional journey and just letting them take the next step and go, yes, I want to go ahead with that treatment plan. Okay, so when they want to, obviously we've got our finance and disclaimers. Well, hopefully nobody takes the tooth out and waves the bill around like this anymore, but you know, you want the patient to accept the treatment plan. So when we present the treatment plan nicely to the patient, it's great if you've got some kind of payment plan option in the practice that just helps them purchase their new treatment plan more effectively, more easily, especially at the moment. When we used to present treatment plans, patients were often left scratching their heads. And the reason that is because we presented the treatment plan in this way. And really, I mean, if we look at this treatment plan, the only people that really understand it are us, because, I mean, obviously we see them every day and we understand, you know, there's going to be a root filling or a crown here. But the patient can't visualize how that's going to look in the mouth, you know, the new crowns. So here we have a beautiful case that Professor Paul Tipton has allowed us to share with you again today. This is a upper 10 veneer case. Now, this lady was obviously presented to Paul and she wanted to go with the veneers. She's obviously got quite a off-center midline, and Paul discussed with her about, you know, shifting that, or we could keep it the same and do the veneers. So she decided that she would like to take a look at not having orthodontic and how the smile would look. So we've imaged that case for Professor Paul Tipton. And as you can see there, there's a beautiful, I think, a beautiful smile that he's created there for her. But the image really gave her a good idea of how things were going to look. So she was pre-qualified and could accept that treatment plan. Okay, so we're going to look at a full case study now from Professor Paul, and he's again been kind enough to share this case with you guys today. this lady came into Paul. She's actually a dancer, and she was on TV and wanted a media smile. So she came in and spoke to Paul about that. And although Paul is obviously a great dentist, he still needs patients to accept his treatment plans if you want to be successful in practice. So, you know, you can ethically talk to the patient and determine exactly what they want. And that's the beauty and where we can come in and help you. So let's look at this transformation smile. We're going to click on crowns and veneers. This again is in real time, okay? So it's so fast for you to be able to show your patients. So left click and release, as we've said, and we can go around the whole smile. This is a full makeover. Okay, and then once we have, follow the flashing instructions up there on the top left. It tells you to go to next, okay? So it's prompting you all the time in the software. And then we can zoom that slider bar in down at the bottom again. And as you can see, by default, as always, 301 goes in first. You can then click on the various teeth and get the shape teeth that you and the patient would like. And then we can click on the adjust transparency in the stretch box. As you can see now, we're stretching the teeth out. We can see the teeth underneath, so we can make sure this is anatomically correct as a two-dimensional photo can be. And this is to gain the acceptance before we embark in our diagnostic models, okay? We've then got the curved bite line we can adjust, and the colour, contrast and brightness there. Once we've got it just as we like and the patient likes, we can obviously then print that photograph out for them to take away. Here we have the before imaged and Paul's, again, actual result, and I'm sure you agree it's another beautiful case presented by Professor Tipton there. Okay, so we're now going to look at the evidence. We're going to look at the testimonials here and how imaging can help you be more successful. We're very lucky to have many leaders in the dental profession from all backgrounds here, from facial aesthetics to ethical sales and everything in between, obviously Professor Tipton as well. But all of these dentists have been kind enough to give us written or video testimonials, and you can see more about that on our website. If you would like to look at the cases again that we've seen today, you can see the excitement that the patients have when they're presented with the treatment plans in this way. And I really hope you've been as excited about imaging as we are. If you'd like to know more about imaging, here is our contact slide here. We've got our telephone numbers, our website information, and obviously you can see more of the software in action on our website, or you can contact us for more information. But I'll open to back to Tipton training now. I don't know if we've got any questions online at the moment. Hello.
Hi, Tracy.
Oh, hi, Louise. Okay, I didn't know if we had any questions.
There's some just in the Q&A box at the bottom. I don't know if you can see them if you stop sharing your screen and go back onto Zoom.
Oh, sorry. Oh, yeah.
Yep.
Oh, how much does the software cost? So the software costs £3,300. It's a one-off payment, okay? We can make that easier for you to purchase over 3 payments. And how much is a subscription? So if you would like to use the actual service, it's £50 a case, or if you purchase the software, if you want to have a bulk of 10, it goes down to £40 a case. And well, send those back and forth to you if required and make any alterations free of charge as well. That's all the questions we've got.
Yeah, brilliant. Thank you so much for the webinar, Tracy. It was brilliant as always. Yeah.
Okay, thanks, Louise. Thank you ever so much.
You're welcome. Take care. Hopefully see you
See
soon.
you soon. Take care. Bye-bye.